Hi and welcome back to Dr. O'Donovan, Medicine Made Easy. In today's video we're going to be covering Addison's disease, and in this video we're going to be covering the following topics. First of all, we'll discuss a definition of Addison's disease. I'll then talk briefly about the epidemiology, followed by the signs and symptoms, and finally we'll go on to discuss treatment of Addison's disease, including how you manage something called an Addisonian crisis. So first of all, what is Addison's disease? Well, Addison's disease, which is also known as primary adrenal insufficiency or hypoadrenalism, is a rare disorder of the adrenal glands. Now, the adrenal glands are two small glands that sit on top of your kidneys, and their job is to produce two essential hormones. These are cortisol and aldosterone. In Addison's disease, the adrenal gland is damaged, so it doesn't produce enough cortisol or aldosterone. So how common is Addison's disease? Well, Addison's disease is a relatively rare condition. In the United Kingdom, there are approximately 9,000 prevalent diagnosed cases, with around 300 new cases every year. In Western countries, it's much more commonly caused by autoimmunity, and this causes around 90% of cases. So let's go on and discuss what symptoms you might see in Addison's disease. Well, diagnosis of Addison's disease is often delayed because the symptoms are non-specific and they often overlap with many other conditions. Early stage symptoms of Addison's disease are similar to more common health conditions such as depression or flu. So as a healthcare professional, it's important to remain vigilant for seemingly vague symptoms, but which when we put them together could point towards a diagnosis of Addison's. Some general symptoms include lack of energy or motivation, so the patient might describe that they're fatigued most of the time. They may also describe muscle weakness, low mood, a loss of appetite and unintentional weight loss, and also increased thirst. Over time, these problems might become more severe and patients can experience further symptoms such as dizziness, fainting, cramps and exhaustion. In terms of physical signs, well, patients affected by Addison's disease can also develop small areas of darkened skin or darkened lips or gums, which you can see in this photo here. So let's move on now and talk briefly about what investigations you might need to do. So if you suspect someone has got Addison's disease in a primary care setting, then you could think about doing a simple urea and electrolyte blood test, and that might reveal that the person has a low sodium and high potassium levels on the blood biochemistry. A 9 AM serum cortisol could also be done, and as a general rule of thumb, if the serum cortisol level is less than 100 nanomoles per litre, the person should be admitted to hospital, and this result would suggest that adrenal insufficiency is highly likely. If the serum cortisol level is between 100 and 500 nanomoles per litre, then the person should be referred to endocrinology for further investigations. So currently the gold standard test for diagnosis of Addison's disease is confirmation in a secondary care setting with adrenocorticotropic hormone stimulation test, also known commonly as the synacthin test. So let's move on now and discuss how you manage Addison's disease. And in this section of the video, we're going to cover what management you would give in an Addisonian crisis, and then what treatment would be given in more stable Addison's. And I want to stress the point that if untreated, Addison's disease is always fatal and lifelong treatment is essential. So if an adrenal crisis is suspected where the person is acutely unwell or hypotensive, so they've got low blood pressure, emergency missions should be arranged, and that's because untreated, an adrenal crisis can rapidly be fatal. In this situation, hydrocortisone should be given intramuscularly or intravenously, and that should be administered before transfer to hospital. In more stable patients or in non-emergency situations, treatment for Addison's disease is initiated and adjusted by a specialist endocrinologist, and repeat prescriptions may be provided in primary care under a shared care arrangement. In these patients, hydrocortisone is usually used for glucocorticoid replacement, and fludrocortisone is used for mineralocorticoid replacement. If you're the doctor or healthcare provider for a patient who has Addison's disease, it's also important to remind them to increase their corticosteroid cover during physical stress, such as illness, injury, or if they're having something like a surgery, and that's to prevent an adrenal crisis. It's also important that the patient recognises the symptoms of an adrenal crisis, and it's important that they've got IM hydrocortisone to be given in an emergency. It's also important that they carry some sort of identification on them. So that could be something like a medic alert bracelet or a card, which would indicate that they have Addison's disease, so that if they have, say, an Addisonian crisis in a public place, people who are first responders on scene know what to do. So I hope you found this video useful and informative. I've included lots of extra useful links in the description box of this video, which contains further information and resources for reading. If you did enjoy the video, please consider giving it a thumbs up, subscribing to the channel if you haven't done so already for new videos every Wednesday and every Sunday. If you've got any questions, comments or queries, just leave them in the comments section below and I'll be sure to get back to you. Thanks once again for watching, and until next time, bye.